Hello and welcome to today's brief presentation on Kawasaki disease. Not quite as deadly as this Kawasaki, but just as painful. Today we will be covering the epidemiology, signs, symptoms, and treatment of Kawasaki disease so that you might better understand this mysterious condition. Before we go into detail, there are a few foundational concepts that need to be covered first. The first of which is that this disease is an inflammatory condition of medium-sized vessels and is of unknown origin. This disease is characterized by fever, swelling, rash, and irritation of the eyes and mouth. This disease is almost always found in young children. Kawasaki disease is also known by a couple of other names, including Kawasaki syndrome and mucocutaneous lymph node syndrome. It is sometimes referred to as mucocutaneous lymph node syndrome because of the irritation of the skin and mucous membranes, as well as lymph node swelling, which covers several of the main signs and symptoms of the disease. Kawasaki disease is named after its discoverer, Tomisaku Kawasaki. Dr. Kawasaki first recorded observations of the disease that would later bear his name in 1961 in Japan. He published his findings in 1967. It was originally thought that Kawasaki disease was limited to Japan only, but in 1976, cases of Kawasaki disease were being reported in Hawaii. The most incredible point about Kawasaki disease is that its causative agent is completely unknown. There has been intense speculation as to its cause. Right now, it seems that the causative agent has been narrowed down to a virus, bacteria, or toxin. Presently, the virus hypothesis has the most backing. Kawasaki disease seems to be the most active in the winter to spring seasons. That this disease is most commonly found in Japan, but incidences in the United States are climbing, and are currently at 4,000 cases per year, or 19 out of every 100,000 children. This disease can affect every ethnic group, but those of Asian descent seem to be more prone to it. One of the more interesting traits about Kawasaki disease is its patterns of infection. Most of the time, the cases are sporadic and spread out, but there are other times when entire communities have an outbreak. Another factor affecting Kawasaki disease contraction is age. As stated earlier, Kawasaki disease is almost always found in children. In fact, 80% of cases occur in children under 5 years old. This disease is very rarely seen in a patient of 8 years or older. Also, boys seem to come down with Kawasaki disease more often than girls. The signs and symptoms most attributable to Kawasaki disease occur in the disease's first phase. In this phase, a long-running fever is the first sign, followed by conjunctivitis, rash, hand and feet swelling, swollen lymph nodes, and cracking and inflamed lips and mouth. The tongue turns bright red and is referred to as strawberry tongue. By this time, the patient is extremely uncomfortable. The fever can last anywhere from 5 to 25 days, with 10 days being the average. The fever usually precedes the other signs and symptoms by 3 to 5 days. In the second phase, the rash on the hands and feet becomes edematous, hardens, and begins to peel off in large sheets. The patient also experiences nausea and vomiting, abdominal pain, joint pain, and diarrhea. The third phase is a gradual decline in all symptoms until the disease resolves itself. This disease has several serious complications that need to be considered and treated if necessary. Most of these complications involve the heart and include myocarditis, pericarditis, arrhythmia, and possible coronary aneurysms. Along with rheumatic fever, Kawasaki disease is one of the top 2 contributors to childhood heart disease. Even with these serious complications, fatalities are relatively rare at 1% untreated. In the United States, fatalities when undergoing treatment are as low as 0.01%. This probably has to do with a fast response on the part of both the parent and the physician. Catching Kawasaki disease early in its progression significantly decreases the chance for serious complications. To detect heart damage, echocardiograms are often used. Most heart problems go away within 5 to 6 months, although on rare cases, they are permanent. Diagnosis of Kawasaki disease is based on signs, symptoms, and history, as well as the ruling out of other diseases. This is because we still do not know the causative agent responsible for Kawasaki disease, and therefore have no way to definitively test for it. The most common diseases considered when diagnosing Kawasaki disease are Rocky Mountain spotted fever, measles, allergic drug reaction, and juvenile rheumatoid arthritis. When testing for Kawasaki disease in the lab, you are mainly looking for signs of inflammation. As such, you can expect to see elevated C-reactive protein levels, elevated erythrocyte sedimentation rate, significant anemia, thrombocytosis, and leukocytosis. Often, blood and urine tests are performed to rule out other diseases. Since we do not know the cause of Kawasaki disease, we can only try to manage the inflammation and prevent damage to the coronary arteries and wait for the disease to pass on its own. The most common prescribed medication is aspirin, since it takes care of the pain, inflammation, fever, rash, and it prevents clotting in the case of a coronary aneurysm. Intravenous gamma globulin is now a standard in Kawasaki disease care, as it prevents coronary artery abnormalities. If the condition does not improve, corticosteroids and tumor necrosis factor blockers may be used to further decrease inflammation. Also, plasmapheresis is used to remove harmful antibodies and proteins from the bloodstream. Children that have been diagnosed and treated for Kawasaki disease should be monitored regularly for signs of latent heart problems. As we conclude, let's take a quick look at what we covered today. We established that Kawasaki disease is an acute inflammatory condition of unknown origin that affects mostly children from the ages of 2 to 5 years old. Treatment for Kawasaki disease is anti-inflammatory in nature, since its causative agent is still unknown. Diagnosis of Kawasaki disease is mainly done on signs and symptoms that present in the first phase of the disease, which includes the fever, rash, and swelling we discussed earlier. If you would like to learn more about Kawasaki disease, please take a moment to visit any of these fine resources. Thank you for your time, and have a great day.